Welcome, members, to this edition of the Texas AFT Know Your Rights webinar. Today, we're going to be talking about what you do when it's time to transition back to an in-person environment or students are starting to come back. How do you take care of yourself? How do you look out for your safety and the safety of our students? And on today's panel, I have a couple of guests with us today. First, I'd like to introduce somebody who you're familiar with from our previous sessions, our legislative counsel, Patty Quincy. Patty, welcome.
Hi. Thanks for having
Joining
me.
us today as well is one of our member leaders, a healthcare provider herself, a registered nurse, school nurse in the Houston Independent School District, Trudy Healthy. Trudy, welcome.
Hi.
Today, we're going to be talking about several things that are really important, not only to you as educators, but to keeping our communities and our school areas safe. Knock on wood, we based on what we've seen opening so far, based on the reports, we actually have had fewer cases than we're expecting. And I think part of that is because we really raised the alarm very early. We've been talking about since March, since this happened, what we need to be doing to keep people safe, what needs to be put in place. We also know, however, that there's a real split, there's a real divide in what's happening within our community. Many of our families that have students that come from communities who have been disproportionately hit by the COVID virus, who've had to deal with more sickness and illness and death, have often been the ones that have chosen not to have their students return in person, to stay virtual. So some of those issues. Know that we have some of our school districts, our larger school districts, particularly ones in our urban areas where populations are much more dense and living closer together, that have taken a longer runway of coming back in, and we're just beginning to see them starting to return to school, and others are slated to start returning next month, by the middle of the month. So we want to make sure over these next few weeks, what are we doing to make sure that you have the information to keep yourself safe? How are you organizing to build that strong voice that you need for yourself and your members directly on your campus, so that when you see something, not only can you say something, but actually make the change necessary to ensure your safety? So I'd like to turn the panel over to Patty. And Patty, let's talk about PPE, particularly what people should expect from what was given to school districts across the state from the Texas Education Agency.
Yes, well, as many of you have probably heard, the Texas Education Agency had some PPE that it was going to distribute. And we've got a slide that'll show you what that looks like. And there's millions and millions of pieces of PPE that the TEA has delivered. Yeah, that's about 3 or 4 slides away. And there's some, one of the things I wanted to point out first is this cartoon. This cartoon right here, I think in a nutshell, says exactly why you need to join the union. As a public employee, you have the right to join or not to join a union. But as we're seeing, there being just these dwindling small supplies for our employees and members, it's not enough to rely on TEA or to rely on the district to provide the PPE you need. So why does it matter that you join a union? It matters that you're not alone, especially during this time when we see people speaking up on matters of student safety. And this is, and we've already seen some people being retaliated against for doing just that, just speaking up on matters of safety. So by joining the union and amplifying your voice on matters on which you are the expert, and these are matters related to children, how children share their food in the cafeteria, how they behave on the buses, knowing this knowledge and having this knowledge in the reopening plan creates a better and safer working conditions for you, but it also creates better and safer learning conditions for the kids that you serve. So this cartoon really is accurate. In fact, where we've seen the best and safest reopening plans, it's where we have the most powerful locals and where we were able to use our leverage and our density to participate in the opening plan. In the next slide, we'll see the list of personal protective equipment items distributed by TEA. In August, TEA distributed masks, both for adults and children, both disposable and reusable masks. They also delivered face shields, thermometers, and of course, hand sanitizers. Now, if you look at these numbers, it's quite a, it looks like a lot. I mean, there's millions of things that have been delivered, but keep in mind, we have 5.1 million students. So while TEA expected this first distribution to last 2 months, what we're actually hearing back from schools is this supply is going to last more like 2 weeks. So this is really concerning to us. And we've spoken to the commissioner, and although their website says that there's no immediate plans to provide additional PPE for districts, this could change, of course, and we've just anecdotally heard from the commissioner that they do plan to provide more PPE. But it's important to remember that this lack of state leadership on the COVID issue, one should assume that districts must rely on themselves to ensure that their staff and students are safe and healthy. And getting adequate PPE supplies and maintaining a safe workplace, though, will require you to be proactive, because again, we can't just assume that the district's going to do what's best for our employees and our students. So it's no coincidence, again, that where we see the best and safest plans is where we have powerful locals that were invited to participate in the reopening plans. There is a link that we have on our COVID resource page, and we'll be posting links in the comment section of the Facebook page throughout the webinar, so please stay tuned for that. But there's a link that we'll put on our, or that is on our website, our COVID website, that shows you exactly how much PPE of each of these categories that each school district received. So this is one of the uses for our tracker, the Texas AFT COVID tracker that we'll discuss a little later, is that you can report where you don't have PPE, where you are lacking that PPE, and we can later inform and kind of notify the state that that's where resources need to be sent immediately. You should, in this next slide, you should be able to find your district's reopening plans on their website. It should be easy to find, because the Commissioner of Education required that these plans be submitted a week before schools open. And on the right side, I'm sorry, you're seeing that's the per district distribution of PPE. And as I mentioned, if the state's not going to provide enough PPE, there's also available vendors. The Texas Association of School Boards is providing direct contact with vendors, and they make these large group purchases. So if you know your district is going to need PPE, make sure that they know about this, that there is no good reason to rely on TEA, because they're really slow to react. And as we've seen, they didn't provide high quality masks, they didn't provide N95 masks and the like. You should be able to find, and we'll look at the next slide where you'll see an example of kind of what the reopening plan looks like. But notice that the Commissioner of Education said back in July that 1 week prior to start, schools should have these reopening plans in place, and they should be developed in consultation with their teachers, staff, and parents. Well, guess what? That doesn't always happen, and we can tell. It's very clear that where staff and employees and teachers were left out, that there are not the safest conditions and best conditions for reopening. So that is troublesome, and something that that we need to really keep a close eye on constantly. And in the next slide, we'll see that there's a lot of things that you're not going to see in your school district plans. These school district plans are kind of going to mirror each other a lot, because TEA put out several model plans. And what I'm assuming is that there's going to be a lot of vagueness to these plans. That's what we've seen, at least in Austin ISD, for example. And the thing is that if you don't speak out, no one else is. There's no administrator that's going to know firsthand the kind of things you know, the kind of things you see, how kids behave and how they don't behave, and what are going to be the best practices. And one example of this is just yesterday we had a Know Your Rights webinar for our Northeast Houston members. And we've already seen several problems, around the state that we've heard from nurse members, for instance. We know nurses are saying there's lack of procedures, lack of protocols when there's positive cases, or when there's a suspected case. We also just heard from a bus driver member who's concerned about kids gathering in very large groups at bus stops. Again, I've never seen a reopening plan that addresses this. So it's so important to involve all of our members, our cafeteria workers who know how kids share food and don't do so in a very hygienic way. We know that bus drivers know how kids behave and don't behave on school buses. So it's critical that we involve all of these folks. And unfortunately, Austin ISD was deemed by our union to be vague and to lack the necessary assurances that staff and parents need when they're making the decision of whether to return to campus or whether to return their child to campus. And we see what Education Austin kind of did in their response. They started tweeting, they started speaking to the media, and basically they were saying, this is too vague, it's not providing the answers that we need to know before we make the decision to risk our lives going back to school. And then they've planned, and these are, kind of a three-peat tweets at once that they tweeted. So, and then it talks about the action that they're going to take this upcoming September 26th. They're going to have a car caravan. So, and an event. So, and then another tweet about joining the union, reminding people, again, this is why we need to join the union. I'd say that in any given year, you must join the union. But this year, now more than ever, you need to be a member of the union. You need someone to have your back in case you don't have support at your school district. So it's really important that we demand that critical support staff be included, and that we have a robust plan that isn't just kind of a vague guideline that TEA just wants, kind of a cut and copy. And let's look at the next slide. One of the things that I just wanted to remember or to remind you is that there are other resources besides TEA, besides our state health services, because remember, these agencies are led by state-appointed, governor-appointed employees. So they're typically going to follow the governor's line, which is not a lot of precautions, not a lot of details. So what we have to do is rely on ourselves and on AFT. What AFT has done is contacted scientists, frontline workers, medical personnel, and created 2 very robust plans with details. Something like this, dwell time, I've never even heard of such a thing, but it's the amount of time that the disinfectant or bleach must remain on a surface prior to wiping. And there is still so much unknown about the virus that we need to make sure that people do the best thing that they can do, and that school districts are providing the resources they need. Another example of speaking out and how that really works is there was a teacher who posted a picture on Twitter of a roll of paper towels and vinegar and water. And that was the extent of her COVID precautions. Something like that was shocking for parents to see. Parents are assuming, again, that schools got that federal money, which they didn't. Parents are assuming every school has a school nurse on it. So that kind of brings me to a transition where we're going to talk to our nurse, Trudy Hilty, who is vice president of the Houston Federation of Teachers, and has been a very vocal advocate of safer campuses for staff and students alike. Turn it over to Trudy.
Hello, everyone, and thank you for attending this. One of the things that I was asked to speak on is, what is school nursing? What do school nurses do? The question should be, what do school nurses not do? Because when it comes to the health and safety of your children, we do everything. School nursing is considered a specialized nursing according to the Board of Nurse Examiners in Texas. We're required to have a certain number of hours, and they have to be in school nursing, which is going to involve a lot of pediatrics, a lot of adolescent health. And because we are focused on school nursing and students, We are experts in that area. In order to be a school nurse, you have to have an RN. You have to be a registered nurse. You cannot be a licensed vocational nurse. It's school nursing is a professional nursing as an RN. Why? Because we've had the educational components to that. We've had clinical experiences. We've had any number of things that we've needed to do in order to do our job successfully. Why are nurses needed now? Well, we're in the middle of a pandemic. We have a virus that's contagious and it's deadly. Our numbers keep increasing, both in cases as well as in deaths. The United States should not be having these types of increases. Nurses are science driven, data driven professionals. We look at the evidence based practices. We read constantly. We are voracious readers when it comes to the topics that affect our kids. We know how to put on masks. We know how to put on gloves. We know how to put on gowns. People might think, okay, well, that's not that hard to do. You just put a mask on or you just put gloves on. But when your hands have been contaminated and you're going to take those gloves off, there's a right way and a wrong way. Nurses are there to teach all stakeholders how to put on personal protective equipment in a way that protects not only them, but also the students and adults around them. What do school nurses do? We do everything. We do screenings, we do assessments, we make care plans, we evaluate the care plans, we do catheterizations, we do G-tube feedings, we serve as a resource. We go into classrooms, and if we have special education students, we go into those classrooms, we look at the environment, we look at what's going on with the social interaction, and we have the education and the experience to make suggestions as to how those students can learn better. We have the experience to look at students and say, this is a good position for the student to be in. This is not a good position for the student to be in. What happens when there's an emergency and there's not a nurse on campus? It depends on how good the secretary or the clerk is and how much knowledge they have and how much the principals and the administrators know. We've had kids come in off of buses or the buses hit a bump. Kids come in and they might have a little cut. And I was talking to one of them. It was, oh, it's just a little cut and my elbow hurts a little. And I'm observing that child and I'm assessing that child. I'm like, no, I think you have a broken bone. So I'm calling the parent. I'm splinting the child. I'm icing the child. The parent comes in and argues with me. Oh, no, it's not broken. Just have them wiggle their fingers for a while and it'll be okay. And I said, no, this child needs to go to an urgent care center or the emergency room. The child came back the next day in the cast because the bone had been broken. Not meaning to say anything negative, but would a secretary have made that same judgment call? Would a clerk or an administrator made that same judgment call? They may have, but there's a whole lot better chance that a nurse on the campus would have because that's what we are trained to do. Parents, you are your child's best advocate. You need to know if there's a nurse on your campus. A lot of times, administrators will put on a website or they'll put on their student handbook that their school nurse is Trudy Hilty. What they haven't done is tell you, I'm only there Mondays, Wednesdays, and Fridays. What they haven't told you is that I'm hourly. You have a student with severe asthma or has a severe allergy to peanuts. We can't schedule emergencies to only be there during those hours or those days when the nurse is there. You have to have, for safety, a full-time, 5-day-a-week nurse on every campus. Some districts choose to share a nurse. They'll have one nurse for 3 campuses. Well, if I'm at the elementary school, the middle school student falls off the monkey bars, or the high school student with a peanut allergy who kisses his girlfriend who just had a peanut butter sandwich, I can't get there in time. I can't assess them. I'm not there to do what they need to do in that true life and death emergency. That's why there needs to be a school nurse on every campus. So, what can you do? Ask questions. Call up the school, email the school, talk to your representative on the school board, and ask, is there a full-time school nurse on my child's campus? And if they say, well, yes, there's a nurse, ask more follow-up questions, because that didn't really answer your question. Because what you wanted to know is, are they there every day? Are they hourly? Are they shared? Because that way you know when you send your asthmatic child or your child with allergies to school, there is a healthcare professional there to look after your student. One other issue is in this pandemic, a lot of people have lost their jobs. A lot of people have had their hours cut. Times are hard for our families. Times are difficult. Many times parents will lose whatever health care they might have had if they had health care from their jobs. Knowing that there's a school nurse on that campus, you know that your child is going to have access to a healthcare professional that can look at your child, observe your child, and make the appropriate assessment and implement a plan of care to take care of your student. So, what do? You make phone calls, you ask a lot of questions, and you write the governor. And you tell him to sign a critically important bill that he did not sign last year, which is to let parents know whether or not there's a full-time 5-day-a-week nurse on their campus. We didn't mandate that every district have enough nurses for every school. We didn't ask districts to hire nurses. All we did was say, please let parents know it is your right to be informed. It is your right to know what's going on at that school and who is there to take care of your child. This was not something that would have been too terribly difficult to do. A simple notification as to whether or not there was a full-time 5-day-a-week nurse at your child's school. You are your child's best advocate. Thank you.
Thank you, Nurse Hill.
Thank you so much, Shoti. On the next slide, I did want to talk a little bit more about the nurse notification bill, which has been a major goal of the Texas AFT Nurses Task Force for over a decade. And as Trudy explained, all we are asking for is for a public school to let parents know. It's just a simple posting on their website that says your nurse's hours or whether or not you have a nurse there every day. And the bill overwhelmingly passed both chambers in 2017, but was vetoed by the governor. And in his veto, he said that this imposes a needless regulatory mandate. Now, this is ridiculous, especially, it was ridiculous then, it is preposterous now when we're in the middle of a global pandemic. And we know that nurses are needed now more than ever because parents are making a decision on whether or not to return their child. And they need that peace of mind of knowing that there's a medical professional on campus at all times. And I think a lot of parents just assume that there's a nurse on campus. So make sure that your friends and parents know that this is something we need to change. And we're going to start with that change next week. We're going to start a letter campaign to the governor to say, Governor, we're really looking forward to how you're going to change your mind about this bill because things have terribly changed and nurses are no longer a needless regulatory mandate. Nurses are an absolute necessity and really a life or death matter. So we really thank Nurse Hilty for coming in and showing us what nursing is about. And yeah, it's really great to remember that there's not a lot nurses don't do. And it's amazing the way, if you have a family member or know a friend who's a nurse, you know that they're constantly assessing, even when they're walking in the hallway. So it's just so important that we have these folks on campus when we're so concerned about kids having symptoms that they might not even know are troublesome. So thank you very much for listening to this part. And next, Zeph is going to talk about our COVID tracker, but we'll first see a quick little film about how this tracker works and exactly what uses it's for. Thank you.
So we've talked about two very important tools to help move safety along on our campuses. First and foremost, advocating to ensure that there is a qualified professional school nurse on every campus is vitally important, not just for the kids that are coming back, but to be that expert, that professional that is able to help guide us on the campus level reopening plans, guide us on how, as Nurse Trudy said, how to properly don PPE, guide us on how to control the disease virus factors. And hopefully, if there's a school nurse on and there's a well-staffed and well-supplied reopening plan, we'll be able to mitigate the cases of breakouts on our campuses. But if we're not, and we know that they're happening, and we're not sure that our school district is providing all of the details to the state in the manner that it needs to, or you may have found, like we've heard from many of our members, if you weren't in the section of the building or the classroom where the student who was found to be COVID positive or the staff member was found to be COVID positive, if you didn't have a direct, close contact with them, you may not have been notified, even though it may have been on your campus. That's another reason why we wanted to share this additional tool with you, the COVID tracker. The Texas A&T COVID tracker is a crowdsourced tool. It will allow you to go on and submit a report. Staff will be looking. You can submit evidence through pictures, whether it's a letter that you did receive from your administration or principal, whether it's a story you saw from the media. If you don't have those things, you may be allowed to provide a narrative that gives facts and details and information. And then you'll have to certify. You'll have to take a certification oath or check off a certification oath that the information you're providing is true and accurate, because we want this to be information that other staff and parents can rely on to at least start the conversation and questions. In addition to the tracker, we believe it's going to be vitally important that our members, our union members, engage on the campus level when they do return by creating safety committees, by working together to make sure that you're important, to make sure that the safety needs that are important to you are available on your campus. So the question I have for you is, do you really think that the boss or the supervisor is going to give you a gold embossed invitation to be part of these committees? You may have some on campus. Some of your colleagues may be invited, but if you haven't been invited, don't let that deter you. Go ask. And if they don't have these committees on your campus, take the initiative to figure out how you form one yourself. Form one through your union on your campus if you need to, because I've got a reality for you. No one is coming to save us, not the government, not TEA, not the districts. We are going to have to look out for one another. We are going to have to take care of one another. We are going to have to ensure one another's safety. So if your campus doesn't have a safety committee, if you haven't been invited or don't know, and you've asked and no one can tell you, go find a few friends. Get a couple of people together. Find your reopening plan on your website. Make sure you're familiar with it. Build your committees so that you've got representation from different job categories. Your plan operator or your custodian, they know what types of materials or what types of chemicals are being used to clean your buildings. They know how long that they're leaving the bleach on the desks so that you know whether there's enough time to actually kill the virus or not. Very important people to have on your committee. We've had some success. Members in Brazosport and Goose Creek, Austin, and the Lone Star community colleges have been forming committees to make sure that they're informing their members and keeping on top of this. These committees are meeting regularly, developing surveys, getting it out to their members, and sharing those results with their school boards so that they can impact policy and make changes for better safety. Take a look at what's happening at Texas AFT United, which is a group of 5 districts in North Texas. They've launched their survey on Monday, and they're working to implement their committee structures within their new organization. Begin your official committee and make sure that when you begin your official committee and you're part of it and you've talked to your union leadership about it, remember what we talked about just a few weeks ago. Being part of that committee, representing those individuals on your campus may actually give you much more protection and room to speak out about the safety issues that you're seeing on your campus or the safety issues that may be brought to your attention by your colleagues. A third tool that we have to help you to build this committee is on our website. I want to take a minute and point this out. I think are we going to talk about this in the next steps? Do we have that website that's in there? Texas AFT has developed a safety toolkit to help you go through this process. We want to invite everyone to make sure that they go through this slideshow, find that link, go to our website, download your toolkit, start working with your members to make sure you are having an impact on your campus and making it as safe for people as possible. So I want to just take a stop now. I know that we've had some questions coming through. Wanted to stop and take a couple of these questions and see if we can get some answers for folks. So this first question that I have is for Patty. It comes from Brenda. And she really wants to know, can teachers sue the district for lack of PPE provided to them?
There are some very strong government statutes that Texas has passed that make it very difficult to sue the district. Now, it's technically a possibility. However, the legislature in January is very serious about passing a bill, and we're going to fight it tooth and nail, but they want to pass a bill to make it impossible to sue the district. But no, if you've got a grossly negligent district, then yes, you could possibly sue them. But again, it really depends a lot on the courts and how they see the case. But it is technically possible.
Yeah, legal remedies may not always be the answer. They may be part of the push. And what you may want to do to make any potential legal case stronger is start organizing from the front. Work with your union. How do you find the stories? How do you know that you're not getting the proper PPE? Who is reporting that to you? Are you capturing their stories? Are you using the tracker or asking those members and staff people to make that report on the tracker that they're not receiving PPE? Because that's a safety report is also an option for turning that into the tracker so that we can help develop the evidence necessary to be successful in that lawsuit. If you're organizing at your campus level, if you're working to take care of one another, then you can work as a group to file a dispute and a grievance against your district. Your union can help you process that. Put letters on letterhead. Anytime that you're able to make noise, build a record, develop evidence around these issues. If it comes to having to sue, you will be able to then strengthen your case and strengthen the case for your employees with you.
Yeah, and
Okay.
something I tell people is that if it's not written down, if it's not in writing, it didn't happen. So always, always get documentation as much as you can.
Trudy, here's a question for you that's really from the health perspective that you may have an answer on. Sam from Richardson ISD is asking, how effective are the mobile shields? Those shields that students carry around with them from class to class, and then they place on their work surface to protect against COVID-19?
Oh, that's a really good question. And I'm really not sure of the answer. I'll be honest with you. I know that we use masks and face shields. They're not mobile. I think any type of barrier that can stop droplets from spreading is going to be somewhat effective. It may not be the most effective. And it depends on how the barrier is made. If it's just something that covers just like the front of the face, that's as good as a mask, perhaps. If it comes this way and covers even more, that would be better. It's going to depend also on how consistently the student uses the mask and uses a face shield. A mask and a face shield is better than nothing. A face shield without the mask, I would not be quite as comfortable with. But I'll do some research on that and get back to you.
I believe there have been some studies that actually show that face shields are more effective when you're wearing masks with them.
Yes, there have been.
And I think that that would probably be the same premise around this desk shield. Trudy, the other question as well too is this is also probably going to be dependent on how well it's cleaned and how often it's cleaned.
Mm-hmm. Yes.
And making sure that you're not, especially if they all look alike, making sure the kids aren't trading them, aren't picking up somebody else's shield just to have one.
Right, because kids lose things. They lose their IDs. The barriers really should not be mobile because students should not be mobile. Students should be at their desk with their barrier around them. And I believe the best thing at that point is to keep the students at their one desk. I would not have students cleaning the face shields. That would be something a custodial staff should do with the appropriate chemicals that are left on for the appropriate amount of time. If you have some kids, they're going to spit on things, which then in turn contaminates the barrier. So there's going to be a lot of factors that play into that. And the best thing to do would be to talk to your custodial staff and look at what your district's policies are as to how those are cleaned and used. And then ask your union.
Absolutely. Patty, another question that's coming back to you. Thank you, Trudy. This was a question regarding ADA. If you submitted an ADA request but haven't received a formal answer, what should be the next step for the member?
You should call the union. They've got a certain amount of time that they're supposed to get back to you on that. And if ADA isn't something that would work, then we can look at the Family Cares Act, which was an extension of the FMLA leave, or find some kind of alternative. But definitely contact the union because they are supposed to get back to you in a timely manner.
And districts are required to give you a written response.
Correct.
Is that correct? Okay.
That's correct.
And that's one of the ways we hold them accountable is they need to put their written response in writing. And this is really important for your unions as well too, is to hold them to that level, because each one they deny, you then have a record of it. Your union has a record of it, so that then your union can work with you and your fellow members to determine how many of them ADA accommodation requests are actually being approved versus how many are being denied. And then on the back end, you can compare the circumstances to each of those individuals who have been both approved and denied to ensure that the process is being fair. Okay, great. We have another question, and this is from Sherilyn ISD. Rogelio, are there any guidelines for PE classes? What is the maximum
Mm.
number of kids per classroom?
Because there's no state leadership, no state mandates or state guidelines, there's nothing that's required. And that is, again, terrifying, and why we need to follow very closely with these reopening plans, because there's just a dearth of leadership. And that's from the federal level to the state level, too. It's not as though the CDE is giving some concrete direction either. But I would say that you would just have to abide by the social distancing, and I just can't see how you could logistically provide that for a sizable group of kids if you had to keep the distance and the protections as well. So yeah, so that's going to be a difficult spot, but it cannot be business as usual. That's for certain. We know how kids sweat in PE and yell and scream, and that's just a lot of airborne pathogens that could be shared around. So while there is no concrete definition of what it should look like, we know, looking at our AFT reporting and our guidelines, we know that it shouldn't be any kind of closer or larger classes than usual. It should be much, much smaller than usual, and if at all possible, outside.
And Patty, we still have, even though they're permissible and they're guides, it still says in the TEA guidelines and in the CDC guidelines, there should be, where possible, and that's the way that they try to get out of it, where possible, 6 feet of distance for social distancing between desks. And in this case, we should say between students in a PE classroom. Your unions can still utilize that. They can still advocate and push. We often know that PE classes get stacked with a double load, and we need to be pushing back on that early and quickly, so that you're able to point out if there's inclement weather and you have to go in a classroom, you're not going to be able to accommodate all of these students safely. They're going to have a backup plan so that you can take half the students in the classroom and the other half are going to have to be delivered elsewhere. Because I guarantee you, they're going to say you can hold more students if you're outside in an outside area. And we've always got to be making sure that we're thinking about those contingency plans. Okay. So we have a question from Brenda. Will districts pay staff and not force us to use leave if we have to quarantine or are hospitalized?
Well, the way it's working technically is that you could first, if you have available sick leave, then they might use that. We haven't technically seen that in practice yet, so we're not sure exactly how districts are going to maneuver that. Again, there is that Families First leave that was passed shortly after the start of COVID, and that provides up to 2 weeks leave, but that's only going through December of 2020. So that's why we are pushing in our additional actions that you can take, this HEROES Act, and asking our senators to pass the HEROES Act, because that could provide the additional leave that folks might need should they need to be away in quarantine, or should they have, be affected by it directly themselves. But without a doubt, it must be the case that our members are safe, and if you don't feel safe, then that's something that we need to talk to with the union and address. But I would suggest, no matter what you're told to do, if you don't feel safe, if you know that it endangers your health, don't do it.
That's exactly right. We definitely need to work through those issues. Beyond those, and this question comes up a lot too, with your leave days and your medical insurance, because there's another question about this. The districts are providing medical insurance as part of your employment. Unless there's a specific case that shows it's work related and you get workers' compensation, which is really, really difficult, the likelihood is your medical insurance is going to be what pays your bills if you're sick. It is your sick leave beyond the 10 days provided by the federal government that you are going to have to rely on if you become sick. They are likely going to argue that this is a community-wide disease, that there's no definitive way that you could have shown that you got it from school. So this is one of the issues as well too. And we have some advice going out to many of our members. Before you return to school, it is our advice that you go to your personal physician, that you have your personal health evaluated, that you get that clear bill of health. If your doctor's checked you out, if you've got a negative test and you were healthy before you had to go to school, and then you end up going to school and receive, get sick from COVID, at least you have some level of evidence that you may be able to take to your attorney, take to your union, take to what have you, if you have to fight for that workers' comp case, if you have to fight for any of the financial implications that may happen. But understand that leave time that you're provided is provided to cover you when you're out sick. It is not something that is gifted to us to use on a whim. It is supposed to be for the sick coverage, and that's the expectation for it. So we want to go through a couple more of these questions. We've got one that is somewhat off the topic, but I'm gonna take this question. It's from JR. How do teachers unions have power without collective bargaining? Well, that's a really interesting question, because I think that seems to be a lot of confusion by people in Texas, particularly educators in Texas, about what collective bargaining is and isn't. Collective bargaining is not anything that's going to necessarily help you get this done one way more than the other. People are talking about collective bargaining like it's the thing that's going to solve all the issues, and if we just had that, everything would be fine. And we know that that's not the case. We know that that's not the case because we have collective bargaining in plenty of other states, and everything's not just perfectly fine. Things didn't magically go away over there. But what we do know, in places like Houston, in places like Chicago, in places where our members have come together and built real power, where they've stood with one another, where they've pushed back on the boss, where they've spoken out on many of these issues, where they have built power regardless of what the tool is or the mechanism is that they use to wield that power, they are able to make change. There is no, it is not a secret. There's no secret as to why school districts like Houston and Los Angeles and Chicago have the longest runways. Like, we're the last ones coming back. That's because our members have stepped up to the line. They've come together. They've built power in their districts. They've built relationships with their leaders. They've moved things with moved relationships with their superintendents, so that we're working together to collaborate as much as possible on having the safest plan. Because even those superintendents, even the people that are working to try to do the right thing, in Alief and Northside and many of our districts across the state that have leaders who've actually stepped up to the plate statewide to talk about safety issues, where we are in agreement with them on many of these things, there's only so far that they can go when the state is the one trying to take away their funding, trying to take away the money that covers your paycheck if we don't comply with some of these issues. There's a reckoning that's about to happen. Our members are going to have to make really tough decisions. We don't want people to quit. We don't want them to leave and retire. And if you're going to do that, don't do it until you can take 1,000 people or more with you. Don't do it until it actually matters. Fight back, push back, get the safety committees meeting. It doesn't mean you have to go on strike. It doesn't mean you have to have a work stoppage. There are plenty of actions that we can do to start elevating and building our power in school districts across the state. The very first one is to stop being afraid. The very first one is be professional, but advocate, push, document, build relationships, work with one another. Collective bargaining is a tool to implement your power. But if you don't have power and you don't build that in the first place, we will never be able to make any of the changes that people want to see. Okay, we're going to take one more question, and then we're going to go back to final next steps on what we can do. Christy's asking, can you take the CARES Act leave if you don't have COVID but just don't feel safe?
No, unfortunately, that it's very specific that the leave must be related to, it can be related to childcare. If you have a child whose childcare facility shut down for whatever reason, that's a use for that care. So it could be related to other issues, but no, so we can possibly find a reason for you to take it. But just saying you don't feel safe is not an allowable use under the language of the federal law.
There may be other options as well too. If you have to care for any other family member, the Family Medical Leave Act may certainly come into play. You certainly have as many leave days as you have in your bank. Generally, you're able to take leave without having a medical excuse for at least the first several days. Check your local school district policy. At least that's something to start with. At least that's something to work with. Call your union, figure out what is going to work best for your particular situation. Make sure that you exhaust every opportunity before you have to make any final decisions. Okay, thank you for those questions. I hope that we were able to get some answers out to you. I'd like to move to closing. What's next? And what are our next steps? Okay, so we've got some next steps in here. Action letters. We talked about several of those today. They're online at Texas AFT. Speak out to the governor. The more that we send, the more pressure that we put on the governor. I just heard this from a superintendent today. Why did you stop putting pressure on the governor? Or why did the rest of the school district stop putting pressure on the governor? The more pressure we put on the governor, the better plans that we are going to receive, the more opportunities we're going to receive to stay safe and stay healthy. Utilize our safety toolkit. Go through that to help put together your safety committees. Having witnesses, having people working with you, having more than one person speaking out is going to be what you need to be able to take care of one another for those that decide to go back to work and you're in this position. Make sure that you review the AFT and the Texas AFT COVID resources pages. There's all of the Know Your Rights sections that we've done earlier, where many of the questions about ADA and FMLA and the Families First Coronavirus Act, we went over them in detail. So if you want to learn more about those issues and still had questions, please go to our COVID resource page, look for those previous webinars, and hopefully they will answer many of your questions. And finally, and of course, utilize that COVID tracker, whether it's for reporting a COVID case or whether it's reporting a safety case because you're not getting the PPE that you need on campuses. We're watching that, we're monitoring that, we're sharing those reports with your local unions, and we're taking action where we see those reports and have a follow-up contact information from the members or the individuals that are providing those reports. So very important to make sure that you share that contact information if you want follow-up and assistance whenever you're putting in those reports. Patty, any closing remarks or anything else that you'd like to add?
I just wanted to say now is the time to join the union. Make sure if you have a colleague who has not joined yet, now is the time to join because we don't know what to expect in the coming year. We don't know how you're going to be treated. So it's best to have that protection before you need it. And lastly, I just want to say thank you for all that you are doing and for persevering and speaking up when it's, I know, a really difficult time for people to do it, but it really, really matters when it comes from you. Thank you.
And the last thing I'll say, ladies and gentlemen, is go out and vote. We're about to be close to an election that's going to make a difference, not only in the state, but across the country, on how we actually respond to this virus, on what level of funding is actually provided to help ensure that we have proper PPE, on our ability to continue in a virtual setting or not. All of these things are very dependent on what this next election process is. Be on the lookout for information from Texas AFT, but no matter what you do, investigate who's on the ballot. Make sure that you make the right decisions. Vote for people that are pro-public education. I don't care if you what party you vote for. just as long as you have made a conscious decision to ensure that they are a pro-public education representative. We know who's not in the White House because they are fighting tooth and nail to privatize everything that we stand for. Privatize this public schools our kids depend on. Privatize the public schools that provide you bread and butter for your own family. Privatize the public schools that built the economy in this country. Look past parties. Vote for your profession. Make sure that your voice is heard. Please continue, watch our website and our emails for the next edition of Know Your Rights. We look forward to seeing you on a Red Wednesday coming up soon. Thank you. This is Zeph Capo saying good night from Texas AFG.